Welcome to a podcast brought to you by the American Academy of Orthopedic Manual Physical Therapists. Our academy is a national organization committed to excellence in orthopedic manual physical therapy practice, education, and research, and we're here to explore a wide range of topics with you through interviews with content experts.
Hello AMP listeners, Antigone Vesey here, and I hope everyone is enjoying a safe and healthy holiday season. I'm excited to kick off our interviews from the 2023 AMP conference. On this episode, I am interviewing Dr. John Umlauf on the feedback portion of the pre-conference that he was a part of. This was titled, Building Bridges, Making Mentorship Meaningful. Here's a little background on him before we dive into the interview. Dr. John Umlauf has over 17 years of federal service as an active duty Army officer. He is currently an associate professor and director of curriculum for the Army Baylor University DPT program. He is board certified in orthopedics, a fellow of the American Academy of Orthopedic Manual Physical Therapists, and certified to perform diagnostic musculoskeletal ultrasound. He received his BS in environmental health from Old Dominion University in 2004, graduated from the Army Baylor DPT program in 2012, and graduated from the Army Baylor University Doctoral Fellowship in Orthopedic Manual Physical Therapy in 2018. Before joining the Army Baylor University DPT faculty in 2021, he served in several academic positions. In addition to his clinic research, he is actively involved in developing holistic health and fitness curriculum for Army physical therapists and advancing the use of diagnostic musculoskeletal ultrasound across military medicine. Dr. Umlauf, welcome to the podcast.
Thank you for having me, Antigone.
This is awesome. I really enjoyed your pre-conference, and I'm so excited that I get the opportunity to talk with you today. Can you just give the listeners a brief overview about your pre-conference session?
Yeah, I'd be happy to. This pre-conference was actually a couple years in the making between myself, Dr. Chris Allen, Dr. Brian Pickens, and Dr. Nate Parsons. We all teach or have taught at the Army Baylor University OMPT program. We've all gone through that program and we all have been on faculty teaching there. And this pre-conference, we've given these different talks in chunks in various settings, whether it was CSM or AOMP or some other settings. And we thought the pre-conference would be a good opportunity for us to kind of meld them together and give the attendees kind of a full piece of what makes mentoring meaningful and things we've learned along the way to help our students progress to meet their potential.
I found it so valuable. And I actually saw Dr. Brian Pickens talk on coaching, mentorship, and sponsorship and interviewed him on the podcast. So I want to call the listeners back to episode 64 when he spoke about the difference of those three terms and just having the language about when you're coaching versus mentoring and how that role transitions into sponsorship where the mentor pulls the mentee forward in their professional career because of their professional leverage. It really helped me as I was teaching students and trying to titrate my mentorship style to the DPTs versus resident versus fellowship level. So that was a really great episode, and I would encourage the listeners to go back and hear that. But I wanted to bring you on specifically because you talked about feedback. And I think this is one of the hardest and most nuanced pieces to that relationship. So I think it's so important for us to really think about how we can grow as mentors in this area. The first question I want to ask you is, what is a mentorship agreement and how do you suggest we implement that?
Yeah, thank you. First, if we think of what mentoring is it's just a process where an experienced person, a mentor, is guiding another individual. In an academic setting, we're thinking about skills, knowledge for the professional development. Mentoring can happen formally and informally. Now, the interesting thing between those is in a formal relationship, it tends to be more productive for both the mentor and the mentee. While informal mentoring is very useful and tends to be really meaningful because it helps build relationships that might last a lifetime, but it's maybe not as productive. So what a mentorship agreement can do is really formalize that relationship for something specific. Because you could have many mentors for different areas where you want to improve. But the agreement can exist to really formalize your communication. It helps both the mentor and the mentee. Oftentimes, we find that as mentees, it's hard to find a mentor, and a lot of that is just the first step of reaching out to an individual. Oftentimes, after you reach out to the individual, what can happen is that you have a meeting, but maybe it kind of fizzles out pretty quickly. If you have a mentorship agreement and formalize that relationship, you can really work towards establishing goals and then thinking about how often and how long to meet to make sure it fits the needs of the mentee while also kind of what the mentor has available to them. And both parties can think about planning ways to meet objectives and those goals, but it also provides a mechanism for two-way feedback between the mentor and the mentee. So if you have a mentorship agreement, it's something formal you can reference. And as a mentor, you can ask the mentee, is the feedback I'm giving you and the opportunities and this relationship, is it helping you achieve your goal, or do we need to try something different? The initial act of developing the mentorship agreement can really be helpful to know and recognize if the mentor or the mentee are a good fit for the specific goal. Dr. Pickens talks a lot about, do you need a coach, mentor, or sponsor? And through the mentorship agreement can really help you recognize, is this a specific goal that you need a coach for, or does it need specific mentoring, or is it even something you're really looking for a sponsor? But again, it's a formal way to help a mentoring relationship become more productive.
I love that. I love getting ahead of the challenges in that way and just setting expectations right off the jump. What does yours look like? What kind of questions do you ask on it? What do you find most helpful?
It really depends on the goals, right? And so it depends on your setting. If you're in a formal academic environment, it might be already set. The goals might be already established, as in, in this part of your fellowship training, here's your specific goals in this academic setting. And so they're already established. And then you can think about assessing where the student is and how they need to change and improve to reach those goals. If it's not in a formal academic setting, maybe it's a junior clinician reaching out to a senior clinician and they want to get better at a specific area. That junior clinician, the first step is really establishing the goals of the mentorship relationship. There's different mechanisms to establish those goals. I like to use peers goals as a useful way of trying to find a good goal setting. And peers goals stands for powerful, easy, emotionally compelling, reachable, and student focused. This could be a mechanism for the mentor to help guide a mentee in developing meaningful goals, because oftentimes I'll find that a student that wants to be in a mentorship relationship with me, they might kind of start with something generic, like, I just want to be a better clinician. And the mentor, as me, I need to kind of guide that and know, okay, but what specifically are you struggling with? And what specific areas can I help you with in improving? And we can go from something kind of generic to something a little bit more specific, just like we develop SMART goals for our students, goals for our mentorship should be SMART. And it should be student focused, because if it's student focused or mentee focused, they're going to be more motivated to change and more receptive to feedback and want to improve.
I really like that. While we're often doing informal mentorship in a clinic setting, when we get to that more formalized mentorship in a residency or fellowship program, sometimes we just divert to the goals of the program, which are obviously important, but it may not be the specific emphasis that the mentee wants to get out of it. And it would be much more motivating to say, yes, we're going to achieve these goals of the program because that's the baseline competency that is why you're here. But we can also tailor this a little more towards you and keep that exciting. So I think that's a really nice conversation to have from the beginning. One of the other things that you discussed that I thought was very important to distinguish between was the difference between feedback and evaluation. I think these terms are often synonymous, but you painted a very clear picture of how they are different and how we approach them differently. Can you define those terms and their difference for our listeners?
Yeah, I'd be happy to. This is an area we like to really spend some time and thought in. Before you can give feedback, I do believe you need to start by evaluating where the student is. And oftentimes, if we're just giving them grades, then the student can be a little bit more focused on the grade and less focused on the feedback on how to get better. I think we think of assessment and evaluation almost a little bit different. If we could define assessment as your assessment of the student against the expectations, and then maybe evaluation is the grade you give them. So if we defined it like that, before you give feedback, I think you need to observe their and assess their abilities through either observation or questioning of some sort. And the students need to know that they're being evaluated against expectations that are transparent and clear, that are fair and valid and reliable. The teacher isn't specific against one observation, that it's multiple observations and they're assessing students along the same expectations. The reason why you want your evaluation grounded in fairness and validity and reliability is so that when you give feedback, it comes from a place of trust and honesty.
I think that's a great point. It's easy to focus on the feedback, but if a student doesn't know where they are in relation to the curve, it's really hard for them to focus their time and energy. And that's something you brought up in the course is that evaluation is a way for them to understand, hey, here's where you're excelling and here's where you should focus your time and energy on getting better. And that needs to be the first step. However, once you have established that, feedback is really the mechanism by which we can improve that. So, what is feedback and how can we make it more effective?
Feedback is a specific area that we focus a lot as a faculty on, and we reflect on how we deliver feedback, the right way to deliver feedback, just as much as we ask our students to reflect on their patient encounters and what to improve on. And I think by doing that, we try to keep feedback an ongoing process. We believe feedback is the most important aspect for learning. Feedback is just the process which the mentor is providing the mentee with information about their performance for the purpose of improving their performance. There's often a gap between feedback, what is given, and what is received. I think this is always the ongoing challenge that we provide feedback and then we don't see a significant change. And a lot of that has to do with feedback isn't a one size fits all. And that has to do with that relationship between the mentor and the mentee growing and developing over time, and the mentor is open to adjusting how they provide feedback. But the impact of feedback also depends on the student's desire to improve and their confidence in their ability to do so. Is their willingness to hear it and to change from the student is extremely important. And then probably the most important is the feedback credible? And was it based off direct observations and associated with specific goals? And we need to almost avoid our opinions or prerogatives and think about helping the learner become independent learners. So it's important that we're helping them achieve their goals and improve along their way.
That's a good point. I always tell my mentees that my goal is not to make them a version of me, but to make them the best version of themselves. Getting your ego out of that is really important and really hard to say, hey, this is my bias and I'm going to present this to you because this is the context in which I'm making this clinical decision. But we have to separate that from clinical reasoning and acknowledge that there are many ways to do things. Specifically, what do you think we should do to make feedback more effective? And is there anything we shouldn't do?
Yeah, as we mentioned, the feedback should be based on goals. It should be specific. I think that's really important. When you give feedback, it's what you saw, then perform, so it's objective. But when you provide feedback, it's important to tie it to a behavior, and that's both positive and negative feedback. So if you saw a behavior of something they did well, let's say it's a patient encounter, let's say it's their interview and they're asking open-ended questions and they're not biased, You don't want to say, well, good job on your interview. Say, you're asking better questions, something more specific on how, and hopefully that learner can reflect on how they improve that specific skill and maybe they can apply it somewhere else. Same thing with areas they need to improve upon. If you just pile it on, like they'll just hear, I did a bad job. And you want them taking away something more specific. Hopefully, the mentor can help you with a goal or an action plan, or I can reflect and think about specifically how do I improve that specific behavior. The other thing is timing is key with feedback. Usually, we want it as soon as you can, that the student has an opportunity to internalize it. And it should be always, hopefully, a conversation that's happening between the mentor and mentee. If you really wait a long time before giving back, it's hard for that student to take that feedback and apply it directly to something and really internalize it and reflect on it. There's a lot of other things with feedback. I talked a little bit about sometimes we're either a dove or a hawk with our assessments or feedbacks, and the dove is always supportive and a hawk is always paying attention to what you did wrong. I tend to be a little bit more of a hawk. I'm trying to be aware of that. It's important to know that negative feedback has an emotional response to students. So whether it's a feedback sandwich, a positive, negative, positive, that is actually not a bad strategy because it can have quite an emotional impact, which might prevent them from trying to apply it and get better. And then, as far as an action plan, when you give feedback, hopefully the learner has the ability to self improve. But if they don't, are you helping them find ways that they can improve upon and overcome those challenges that they're having? Maybe it's like a specific behavior that they did during the encounter. Do they have time to improve before you observe them again? Because it's not really fair to tell a student get better at X and then not giving them time and opportunity to get better at it before you assess them again. And then before you really give feedback, one of the probably most important things, I probably should have started with this, is a positive learning climate is extremely important when you're giving feedback. So feedback actually to be meaningful needs to come from a place of trust and honesty. And if you have a positive learning climate, that's pretty important because otherwise the student or mentee might receive feedback, but they might not really do anything with it and move forward.
Definitely. The positive learning climate you're speaking to is kind of like therapeutic alliance with our patient, is we kind of need therapeutic alliance with our mentee in order to have the most out of that relationship from both sides.
I couldn't agree more. Having a positive learning climate is extremely important. As I mentioned before, I asked my mentees for feedback on our relationship. So it's almost getting feedback on your feedback. And establishing a positive learning climate needs to be ongoing, and there are specific things we can do as teachers to make sure it's coming from respect and comfort to meet our students kind of where they are and try to have our feedback sessions be more of a conversation than just one way piling on be better, if that makes sense.
It definitely makes sense. I think it's really easy to just emulate the mentors we've had before us, but it's really impactful and important to think about feedback as a skill, like you would a joint mobilization, that it is something you need to get feedback yourself on and to perfect and take the time to grow as a mentor, which is why I think this conversation is so important. This actually leads really nicely into this next question. You mentioned how when you are doing your mentorship agreement or one of those first meetings with your mentee, you talk about three assumptions that you have for them. I wrote these down verbatim because I thought this was a really nice way to enter into this relationship and start that positive climate and get ahead of some of these challenges. Can you tell our listeners what those three assumptions are? I thought it was beautifully said.
Yeah, I say there's three things that I'm going to assume about you and three things you can assume about me. The three things I'm going to assume about you are that you're brilliant. You wouldn't have gotten here and into this program if you weren't, that you can handle this material. You have the cognitive skills to master the material that we have in this program. that you want to do the right thing and you want to provide the best care that you're capable of giving to your patients. And the last is that you want to get better as a clinician and you're looking for feedback from me to help you become the best clinician you can be. The three things you can assume about me is number one, I care about you first as an individual, first and foremost. And I care that you succeed. And then I care about you as a physical therapist and one of my future peers. Two, I take my job very seriously, but I do not take myself seriously. So I know that I make a lot of mistakes. Please help me if I'm not helping you become a better clinician. I'm not giving you the right feedback. Please tell me. I want to get better and I always want to improve my abilities as a mentor. And the last thing is, I'm going to give you feedback. And that feedback might not always be positive, but it comes from a place that is intending to help you become the best person that you can be, because I believe that you are brilliant and you can handle the material and you want to do the right thing. And I give you that feedback because I care about you and who you're going to become as a professional physical therapist in my field.
That's really well said. That's such a nice place to come at a mentor and mentee relationship from. And it almost gave me the chills just imagining what it would feel like for a mentor to say that to me, even now in my career. So I think it's a really important place to start. While it's really nice to picture this perfect world where we have this great positive climate, we as a mentor are super open to feedback and getting feedback and adjusting, and our learners are just excelling and doing a really great job. We do know that there are struggling learners and that this relationship is really challenging, especially for those individuals. Can you talk about your experience with struggling learners and maybe how you suggest we can provide feedback for these individuals?
Yeah, happy to. The struggling learner isn't something I think we prepare for initially. At least I didn't as an educator. I had several students that all were very successful for a while, and then you hit the one that's just not achieving the milestones that you expect. And unfortunately, we learn from our mistakes. And how much I've learned about helping or remediating struggling learners has come from making a lot of mistakes and having to do a lot more research on how to deal with a struggling learner. So, first and foremost, we need to recognize that they're not meeting the expectations of the training program if we just define them like that. First, we probably need to take a step back and make sure our assessment strategies are aligned with those objectives and look at our own plan. It really needs to be transparent and clear what the expectations are. And when we identify a student, a struggling learner, the best case scenario, in my opinion, is the struggling learner is well aware that they are struggling because we've had enough time to give them feedback to evaluate their abilities. So when we say, you're not meeting the expectations, it's not a halo effect where we're looking at one performance. It's multiple areas, multiple observations that we can reference to an assessment framework or program goal, and we can align the assessment strategies to those desired outcomes. It helps us construct individual remediation strategies that are aligned to help them improve. My experience initially was one that's not fair to the student. You're just not where the other students are. And that's another way it's not fair to the student because it's not an assessment framework or goal. It's kind of normative assessment. And I had to take a step back and think about that student and determine, were they struggling because they're just not performing compared to where their cohort is, or are they not meeting specific program goals? Because again, it comes from a place where you want your student to earn their grades, let's say, and you don't give them grades. So if you can make it as objective as possible, that's really helpful. Probably the most important aspects of dealing with the struggling learner is identification, and it needs to happen as quick and as early as possible so that you can start a remediation strategy that is going to help them become successful students.
how would you suggest we provide feedback or remediation for these individuals?
Yeah, a great question. So the most important thing is don't merely just give them more time. Evidence has shown that you just repeat the experience without support. That doesn't seem to be a strategy works out well for the students. If you just extend time, let's say they're in a clinical setting and they're not performing after 4 weeks, and you keep the same setting and just give them 4 more weeks, they're not going to significantly improve without a remediation strategy and without support. So, as far as remediating, the most successful ways that I would recommend people achieve this would be having remediation services that are one on one, kind of dyadic mentor mentee relationships where we can explore and consider contextual influences and really develop a remediation strategy that can provide longitudinal mentorship and tutoring. Then you can really identify areas, whether it's like study skills or maybe collaborative planning. You can determine how to give better feedback and maybe provide individual assessments that are better for them. You can probably look at your sources of observations and data. Again, we want to avoid a halo effect. So you're not making all of your decisions based off one observation, that you have multiple domains of observing these students so you avoid biases and tunnel vision. And then try to frame it as a positive experience. I can't tell you how many times I've had students where we're on a remediation strategy and they feel like they're being punished. When this happens, oftentimes they might actually not seek feedback to get better, because they might see that if they ask for help or feedback, they could see that as they're still struggling and they still need support. So it needs to be framed as much as you can as a positive experience. Lastly, what can be really helpful is assisting learners with self regulation, and building their self efficacy can be really important, because as soon as you put them on a remediation strategy, consider yourselves, as soon as someone tells you you're not achieving where you expect to be, and our learners usually come from a place of being high performers. They're in graduate school or they've seeking out fellowship training, and as soon as you tell them, you're not where you should be, it can be hard to dig themselves out. So building their self-efficacy, whether that is short-term wins that can align with a long-term goal, can be really helpful. I like to say self-calibration is an interesting element of self-efficacy, which is, you think of self-efficacy as your confidence in your own skill to do something. Calibration accuracy would be, how close is your confidence to your ability? Sometimes this can be, your novice students. I find sometimes it could be a little scary where they're a little overconfident to their skill set. And so, the overconfident non-expert, maybe they haven't been able to have someone give them feedback. They have specific areas that need to be improved. But also on the other end, where their confidence is so low that you need to have positive experiences. There's a lot of different elements of self-efficacy and building self-efficacy that can be really valuable for these students. So if you can draw their attention as much as possible to areas where they've succeeded and are improving, and show them and help them identify those areas, that confidence can build and improve, and can then keep building on those initial wins to get longer and bigger wins. Hopefully, you're not thinking of removing the student from the program. The purpose of remediating is to get them back on track for success. Hopefully, we're accomplishing that in a way that helps our student best meet the goals of the program and their individual goals.
That's a great answer. And the point of remediation feeling like a failure versus a learning opportunity, I think, is a really important one. I remember specifically in fellowship, I had my final live patient exam and I got a super easy eval. And I was gloating. I was like, this is great. I'm going to crush this. Because I was thinking more about evaluation, right? I'm here for the grade. And afterwards, my mentor just looked at me and said, do you think that was a good learning opportunity? And I was like, no, it wasn't. And we just had a real moment. And they said, I want you to do this again. and not because you failed or didn't do well, but because I want to give you the opportunity to demonstrate all that you know. And I don't feel like I got to see that today. And that really stuck with me as the feedback piece of, this is why I'm here. This is what I wanted. And I didn't get to demonstrate that today. And there's a better learning opportunity out there. So I really like that concept of remediation not feeling like a failure, but as another opportunity to get better, which, calling back to your initial assumptions, set the groundwork for that conversation. John, this was wonderful. Is there anything else that you want to tell our listeners about feedback or mentorship?
I would tell you, we talk a lot about mentorship and our relationships with our students. And we talk a lot about how we give feedback. And we try to reflect on it as much as possible, to the point where I would say, as a mentor, I now reflect on mentoring just as much as I reflect on my patient encounters. And I'd almost treat each meeting I have with a student, each mentorship session, like a patient encounter to reflect on. And so I am always trying to get better. I don't feel like I know exactly how to give every student feedback. I don't feel like I am the best mentor I can be yet. I'm still trying to get better and improve upon it. And I hope that when I work with my students, they see that in me as a modeling behavior for them to hopefully always want to get better in whatever they do. And we all want to be lifelong learners, no matter what context of education or life we're in. And so it's been great having this team that I have, that we talk about these things a lot with each other.
That's beautiful. Dr. Umlauf, thank you so much for your time. I cannot wait to get this episode out.
Thank you for having me.
This has been a production of the American Academy of Orthopedic Manual Physical Therapists. You can learn more about the Academy by visiting our website at aaompt.org. You can also find us on Facebook, Twitter, and Instagram by searching for our acronym, AAOMPT. The views and opinions expressed on the AOMPT podcast are those of the interviewers and interviewees and do not represent the official position of AOMPT. The information presented should not be used as personal healthcare or clinical practice advice. If you need to find an expert orthopedic physical therapist near you, then check out the Find a Fellow feature under the Public Resources tab at www.aaompt.org, which you can find in the show notes.